Okay, we're currently in a supermarket car park out in the community in Nottingham City. The purpose of this programme is to identify lung cancer early. What we want to do as a programme is bring the screening to people in their local community to save them having to go into hospitals and in trusts. So at the moment, the age range is 55 to 74. Anybody that's ever been a smoker, so a minimum of 100 cigarettes is what we're looking for. So anybody who falls into that bracket is eligible to have the lung cancer screening. So actually prior to turning up to a face-to-face appointment, they'll receive a telephone call. The telephone call will ask them some simple general health and smoking questions and identify whether or not they're at high or low risk of developing lung cancer in the next 5 years. If they come out as high risk, they'll get a face-to-face appointment within the next 4 weeks and they'll be invited to the unit. When they arrive at the unit, they'll be meted and greeted, ID checks, they'll have the height and weight done, and then we'll go through that risk assessment again to make sure that we've got the answers correct.
So that would mean that you smoked for 23 years?
That must be about right.
Does that sound about right?
If they then continue as high risk, there and then they'll come across to the CT unit and have a low dose CT. So the CT itself is a very quick, painless procedure. It's a donut type machine. You'll just need to lay flat. You can be propped up on some pillows and it takes about 1 to 2 minutes where you'll just lay down flat and have the CT done.
Okay, now please keep still and take a deep breath.
You'll then get the results from us within the next 4 weeks. The unit itself is really open. There's a beautiful picture on the wall and it actually looks like a donut, so you can see light between both sides. The radiographers are really experienced as well, so if you do feel a bit of claustrophobia or anxiety, they send you feet in first so your head's not in the unit either, and it's very quick.
And the CT scan was no problem. I felt comfortable and it's very easy. And don't ever be afraid of CT scanners.